Dr. Flanders, I'm wondering if in your introduction you could provide some helpful tips for mindfulness work for if people are feeling down, and then also how to identify anxiety disorders or major depression, and just a few other comments from some other IBD patients that they've sort of discussed is perhaps how to support people, like how to cope with anxiety, especially if they already have more mental health challenges, and then this added stress around this environment with, or the situation we're now in with COVID. So I'm passing the baton over to you.
All right. Thank you, Sandra. I may need you to cue me on some of those questions again, but I'll just start by introducing myself. So my name is Joe, and I'm a psychologist and the founder of Mindspace, which is a psychology clinic in Montreal. And we offer primarily our expertise is in mindfulness-based interventions. And I would say I'm not immune to any of the challenges that everyone here and everyone in the world is facing. I'm locked in. I've got little kids, and so it's a big challenge to keep them entertained and structured and getting along. I'm still working, although half the day now because my wife is also working, and so there's a huge amount going on. And I think this is a sort of common experience that people are having, namely that the day is super condensed and there's not a lot of space. And then there are other people who have just way too much time on their hands that are struggling with that. I think the bottom line here is that this whole experience is just raising the level of stress for everybody. And so if someone is prone to anxiety, they're just at baseline that much closer to the threshold. And so, and you know, the members here who have IBD, there's probably already a heightened level of anxiety, and so, or stress or what have you. And so this is just a major challenge for a lot of people, myself included. I just wanted to make sure that people understand that I'm in the same boat. What I have going for me is that I've learned a lot about how the mind works and how the brain works, and I've developed a practice, a well-being practice, primarily centered around mindfulness, that has been incredibly helpful for me to cope. And so I guess I could just sort of name some of the key ingredients for that. I think I was pleased to see many of the recommendations around routine and structure. I totally agree. It's totally essential. Keeping sleep routines, good sleep hygiene is essential. And that typically involves just sort of on a basic level, going to bed and waking up at the same time every night, making sure that you're sort of unwinding for half an hour to an hour before, maybe putting your mobile device or computer aside for, as I said, a half an hour or an hour. Keeping routine is essential. There's one very, very important consideration, which is in a heightened state of arousal and stress, it's so important to understand that our bodies are mobilizing resources to confront a threat, okay? And so the brain systems that are managing that are essentially the same brain systems that are processing the fight or flight response in more basic mammalian brains, like an antelope that has to defend itself or deal with a threat from a predatory animal like a lion or something like that. So what happens is when the threat is detected, the body mobilizes a huge amount of energy, and the energy is used to fight or flee. It's the famous fight or flight response. And the weird thing about our circumstances is this threat, this virus that is tearing its way through the world, is abstract. It can't be seen or touched. It is very, very difficult to conceptualize and understand at this sort of basic corporal level. And so we've got all this energy and we got nothing to do. There's no solutions. There's no way to mobilize in any physical way. And so we end up sitting at home stewing in our own stress and anxiety. And so number one on my list of recommendations for people is to get outside and use your body. Feel your legs moving, get your cardio up if you can. Not everybody can, but you do your best. It's essential to engage your body and kind of express this energy that's building up. If not, it can just continue to spiral down and feedback and create more anxiety. Another very important principle that I'm coaching a lot of people on and guiding practices on is around tolerating the uncertainty that we're all facing. So this goes very deep, right? How long are we locked in? Am I going to get the virus? What's going to happen to the economy? Are we going to end up in some kind of like social breakdown? What's going to happen in the U.S. with the election? Are we going to continue to have the supply chain for food? Are we going to be able to go to the grocery store and get everything we need? So all these things can really accelerate in our minds, and thinking about them can stimulate some anxiety. And then that anxiety makes us more prone to asking those questions and contemplating catastrophic scenarios. And it's another one of these sort of downward spirals. And so another sort of essential recommendation, as far as I'm concerned, is being very, very skillful around how you work with those kinds of thoughts. And to me, the key practice there, and this is really one of the core principles of mindfulness, is to be able to get out of your mind and get into your body. Again, coming back to the body, because the body is the thing that is reacting here. So getting out of your mind and into your body means using your senses, looking at things, listening to things, touching things. If you're quarantining with loved ones and you don't have to practice the 2 meters or whatever, give people a hug. Get involved with your senses and pay attention. Really bring your attention into those moments, because the more you're involved with your senses, the more you're engaged with your physical surroundings, the less you are caught in these spirals of catastrophic thinking and thoughts that sort of perpetuate stress. So use your body. And if these thoughts are very, very difficult to shake, a more formal kind of mindfulness practice might be appropriate. And I'm just going to take 1 minute and offer a very brief sort of practice around tolerating uncertainty. And you guys are all welcome to try it. I recommend closing your eyes if that's comfortable for you, and sitting in a upright and comfortable posture. If you're lying down, that's okay too. And just for a brief moment, I know we're running out of time shortly, but I do want to give people a sample of how this works. If you're now directing your attention inward, you might become aware of what's happening inside your body, what's happening in your mind, what thoughts are present, what emotions are present. And the invitation here, just for about 10 seconds, is to open up to all of those things and just let them in. Allow whatever is present in your experience to be there without needing to change it in any way. And as you do that, again, you might sort of have the disruption from your thoughts, and all of that is fine. The key thing I'd like you to practice is to try on the phrase, it's okay. Right now, it's okay. Things might get complicated in the future, and I'll have to cross that bridge when you get to it. But right now, it's okay. Right now, it's okay. So you can try that phrase for yourself and see what happens. It's another way of re-engaging with the present moment and checking in with the present moment, again, using your senses if that's possible. And so if you've been directing your attention inward and practicing in a more formal way, this would be the time to open your eyes and kind of re-engage with the webinar here. And I've got a recording of that practice, slightly longer, on my Facebook page. It's Dr. Joe Flanders on Facebook. It's also listed at the Mindspace Wellbeing Facebook page. I think the host will post links to that here in the webinar. Again, the key thing, just to summarize, is to use your body to connect with the sensory aspects of the present moment, and to use that practice as an antidote to the catastrophic thinking, particularly right now it's okay.